1996, he founded the organization Prevention and Healing, Inc., and is the author of the book Accidental Cure. So everybody, if you please welcome to the stage, Dr. Simon Yu.
So my topic will be on missing links and case studies, dental, parasite, and allergy immunology point, connecting the dot with Acupuncture Meridian Assessment. Lancet just came out in July 2019, talk about why oral health matters. They need time for reform. They need radical actions for global health. But they're talking about dental caries, periodontal problems, and oral cancers. They don't talk about the amalgam, root canals, cavitation, and all those dental materials and airway problems. So we're going to go into more in depth, but my main topic will be on parasite and connection with the dental. So the objective for the lecture to recognize that parasites and dental problems are always overlooked in medical and also dental practice. There's a new way of detecting parasite and hidden dental problems by using current technology based on EAB, electro-acupuncture, according to Dr. Voll. And I simplify the version and I call it AMA, or Acupuncture Meridian Assessment. I'll give you some case studies, and the anti-aging medicine, cancer, Lyme, and all complex chronic disease must be also addressed by holistic biological dentists. So those crime, murder, and miracles all happen in the dental chair. The crime was done by the amalgams and root canals by the regular dentist. And we as a physician, with every intention to help patients, we end up killing patients. And those miracles happen when I send to the biological dentist, get the root canal out, some of the infected implants out, and cavitations, and all the amalgams out. So it all happened in the dental chair. So EAB developed by Dr. Voll, and I simplify the whole process, and I call it Acupuncture Meridian Assessment. The classical EAB takes at least 2-3 hours or more, and I can do all those basic EAB meridian testing in about 10 minutes to 15 minutes. And I simplify the whole process. A lot of these EAB practitioners saying, you're not doing EAB, something different, so I just gave a name as a new name for AMA as a simplified version of a EAB. So let me give you this as a sort of an overview. The patient comes, and I check usually 40 main acupuncture points. It says right hand, right foot, left foot. And there's a patient comes with a 37-year-old lady with a chronic Lyme, fatigue, fibromyalgia, neuropathy. And that's what I check. Just check all those 40 points. Green means within normal range. Scale from 0 to 100, 45 to 55 is considered normal range. And the actual scale is 0 to 600,000 ohms. We are measuring in skin resistivity, in conductance and resistance as ohms. So red means recent inflammation. You might be able to pick up through the SED rate or to C-reactive protein. Green means within normal range. Blue means chronic degeneration or chronic inflammation. You heard about the rain test this morning. We'll talk about how to tie it together. So by measuring this 40 main point, I'm looking for pattern recognition. All those meridian system has been known for thousands of years. So this is not a new information. This is what I call 5,000-year-old new disruptive technology. Because it's so old, it becomes actually new. I started with Dr. Cook about 25, 30 years ago. He retired a couple of years ago, but he's my main mentor. I got into this dental medical connection. And let's start with the case study here. Here's a 67-year-old white man with the adenocarcinoma of the soft and hard palate. He's got mass down here. He saw the dentist. He said, I don't think there's a dental problem. Sent to the ear, nose, and throat specialist. They end up getting the biopsy, and they found out this is a cancer. What you need is half of your face should be removed, radiation, chemotherapy. That's the standard recommendation. They end up going to MD Anderson, same recommendation. When I check on him, only thing I see is that this is the lymphatic system of the dental on the right side, the lymphatic system of the dental on the left side. That's the only problem we have. The rest of them are all fine. When I get the dental x-ray, got 9 root canals, and he's got massive metals. This is main problem. The treatment is pull all those tooth out. And most people, when I tell them to pull the tooth out, most people do not come back to see me. But in his case, either losing his face or maybe saving his life. He ended up pulling the tooth and saving his life. So 1 out of 2 men or 1 out of 3 women develop cancer during their lifetime. And is there a role for biological dentistry in cancer, Lyme, and all chronic complex problems? Yeah, you probably know you've played such an important role. You probably don't know the potential, how important your role is actually if you're working with the physicians together. Another case here, 36-year-old white female came from Hawaii with a 3rd recurrent left breast cancer. She had a chemo, no radiation, but she's on tamoxifen. When I checked, this is an allergy immunology point. Here's a dental point, allergy immunology point. This is a triple warmer that control part of her left breast, the liver, stomach, and gallbladder meridian. I am looking for the pattern. She's got dental problem, and I see the connection with the 3E. That's a triple warmer controlling the breast of the hormonal aspects of the left breast. And she's got parasite problem here, and allergy immunology point. That's what I will pick up. Heavy metal problem, fungal problem, environmental toxins, and this is part of the modern medical illness pick up from the allergy immunology point. This classical Chinese acupuncture, I can balance very easily with a parasite medication, except 2 areas I cannot fix. One is a dental problem, second one is allergy immunology point. This is where I see heavy metal, fungal, environmental toxins, and let's take a look what we got here. When I check, she got infection down here, looks fine, but they're looking at the regular x-ray, but I'm picking up the signal, which if you look at from here, I'm picking up, there is a dental problem here. Here's a female breast point, and what I'm seeing is, this is where the problem is coming from. I just couldn't convince the 3-tooth to pull, but she was able to pull that correspond to breast meridian. And I tell my patient, most of my patients comes from out of state. When they leave St. Louis, they usually leave St. Louis without the tooth. So this is what I call toothless in St. Louis. So I don't just look for, dental problem. Look at this, the perfectly normal looking tooth. Here's an entamoeba. There's a treponema. Treponema denticola is mimicking exactly like a Lyme, and there's an entamoeba. Today we talk about the Rantis by Dr. Leishman. I think what the Rantis looking is going after the actual parasite problem. I also check for all cancer patients for heavy metals. I was already picking up from the allergy immunology point. I'm suspecting heavy metal problem. And this patient have a massive amounts of mercury at 150, and she does eat quite a fish from Hawaii. She was actually moved from California to Hawaii. And I also check for, in her case, fungal toxins, and she also have massive amounts of fungal ochre toxin at 144. Anything above 4 to 20 is considered too high. Ochre toxin is carcinogenic, immunosuppressive. I also check for the environmental toxin, and she got acrylamide, and she's got organophosphate. These are all those conditions creating her to have a cancer to come back 3rd times. She was scared. She heard my name. So we took the tooth out, went through all the cleansing, detox. She got all those triple antibiotics with the tinidazole, with the doxycycline and amoxicillin, and her tumor becoming more like a consolidating. I just got a message from her. They did have a lumpectomy, and now it's totally margin-free. If you don't correct the underlying problem, cancer will always come back. So you have to clean the underlying problem, so the cancer will shrink, the margin will be clear, you do lumpectomy, and you'll have a clear margin. Here's another case, 52-year-old Boeing engineer with a squamous cell cancer of the right thumb. I saw him 15 years before with a inflammatory bowel disease with the ulcerative colitis. I was able to solve his problem by pulling one of his tooth. And he came back 10 years later with a squamous cell cancer of the right thumb. It was a pus was trending down, and it was continue to grow and eventually become fungating mass in his thumb. Only thing I see is a dental problem here. It's a lymphatic system. It just gives you a clue what to look for. Dental problem. I sent to the biological dentist. X-ray does not show. CT scan, cone beam does not show. Nothing shows. We could not justify him to get his tooth to be pulled. Actually, number 11 was infected down here. It was pulled, some improvement, and then tumor coming back. And I'm picking up, and number 10 is also a problem. Couldn't convince the dentist, pulled the tooth, went back and forth over 1 year. Eventually, we are in a position where he had to amputate his thumb, or maybe I have to give a long shot at it and pull the tooth out. Now, I've been doing long enough. If you look at the DNA test, there's an entamoeba. I see all those cancer patients, amoeba, protozoal infections, often have a treponema, the spirochete infections. So the day he take the tooth pulled out, I put him on tinidazole to cover for the entamoeba, and the doxycycline or azithromycin, and then amoxicillin to cover for the streptococcal infections for 21 days. And then what happened was, he told me it just shrank, almost spontaneous, the mass shrinking down to almost normal. And the oncologist wanted to do radiation. I said, don't do the radiation, let it heal on its own. But they scared him to the radiation, and next thing you know, it went spread and to the axilla, to the clavicle, and to the lung, and he ended up dying from the metastasis. Just give you an idea. Over here you were able to see the infection down here, but the number 10 you couldn't see by CT scan of the cone beam. So you cannot rely on cone beam because we're looking at it from energetic system. We're getting into subtle energy field. In his case, if you look at his DNA test, he's got cytomegalovirus, actinomyces, he's got entamoeba. I see this cancer patient over and over this parasite problem, and they don't always correspond to dental chart. So what I learned from this, you cannot really rely on the dental x-ray alone. Cone beam is not sensitive enough for some of those subtle infections, and dental chart doesn't always correspond. Some of the weak link, people will go infection will settle at whatever the weak link is. Here's another 49-year-old female from Austin, Texas, with a third recurrent breast cancer. When you have a third time, that means they never address the underlying problem. In this patient, again, we see dental problem here, dental problem, triple warmer controlling the breast point, and that's where the infection is coming from. They've done every known test, CT scan, cone beam, nothing shows. And over here, if you look at it, here's again entamoeba. It's a parasite connection with the dental infections and to the breast. It's connecting the pattern recognition, dental parasite. So many breast cancer patients I see have a dental infection that was not recognized. And I can detect through the Acupuncture Meridian Assessment. And we look for cancer profile. We can see that phosphohexoisomerase is one of the before you develop cancer, before cancer stem cell, you see the enzymatic change. This is phosphohexoisomerase is what you expect to see when the cell is converting into anaerobic conditions. And normal should be about below 30. Her level was 84.6, and I'll be tracking that to make sure patient's cancer is responding. Here's a 68-year-old white man with an ARS diagnosed August 2013. Saw him in September 2013. Chip complaint, weakness of the arm and legs, dragging his left leg, spasm, twitching. So two major institutions by the neurologists. They are 90% sure they got ARS. They will be 100% sure when he will be in the wheelchair. He didn't like the art, and he came to see me. When I checked, here's a dental problem showing up here. Here's a nervous system. Here's an allergy, immunology point. Dental problem showing up here again. Heart meridian, liver and gallbladder meridian. When I see liver and gallbladder meridian, we're dealing with a parasite problem. When I see dental and heart meridian, I'm looking at wisdom tooth areas and the allergy, immunology point. This is what I'll be looking at, the, as I say, heavy metal, fungal, environmental toxin. So he's got root canal here, but he got infection down here. It's all infected down here. I marked it, and I sent to the dentist, get a tooth to be extracted. And then he's got high in lead, mercury, tungsten, antimony by DMPS provocation test. He's highly allergic to mushroom, low testosterone, pretty much roundable ivermectin, albendazole, alinea, praziquantel, antifungal, itraconazole, and low-dose naltrexone. And pretty much what we call insulin potentiation therapy, using the insulin to lower his blood sugar level down and give him antiviral, antibacterial, antifungal, antiprotozoal, antiparasitic medication, and pretty much microcurrent to regenerate his muscle mass. So what we are looking for is a change in pattern from the original one. Just keep monitoring it until maintaining all his meridian system, and I will challenge his body to make sure he can maintain. And he wrote a book actually 2 years later called Unexpected Journey. After 1.5 years later, he became stable, and when he went back to see the neurologist, they say, I think we made a mistake. I think you don't have an ARS. So he wrote a book, and he's been doing just fine. And this is why you have to make a what I call battle plan. When you have a life-threatening problem, you need a battle plan. And one of the important, I guess, a physician will be working with a dentist together. Yeah, it's not. One on top case is a airline pilot, female airline pilot with some unusual mixed autoimmune disorder. She cannot bend her fingers, and she cannot fly anymore. And she was told she got all those implants and the root canals. And the solution is usually just put all those tools out. Understanding patient will never come and see me again. But she actually did because she's going to lose her job, and she can fly again. She wears full denture. This particular patient have a blood pressure of 260 over 160. And only thing I see is a dental problem, sent to the oral surgeon to clean out. And this is not my drawing. This is the oral surgeon's drawing of a cavitation. The next day, blood pressure dropped down to 140 over 90 from 260 over 160. I did not put on any blood pressure medication. So certain risk factors I'll be looking at. The Lux is based on the parasite and dental problem, but I always look at all those other parameters also too. And for the dental aspects of it, the big one will be for me parasite and the bruxism and also TMJ. It only takes for me at the dental point few seconds to check whether you have a bite problem or not. When you put a tray of the parasite medication, all of a sudden dental problem balances out. That usually means either TMJ or bruxism, and they often have also airway problems. So these are things I look for. And so what I'm looking for is actually cause of inflammation. The one I showed about the red is acute inflammation. I don't see those more in my practice. I see usually chronic inflammation. That's more what we call silent inflammation. What Dr. Leishner talks about, the rhinitis. Most common silent infection I see are dental problems and the gut problem, the fungal, bacterial, virus, and parasite problem. So if you look at the inflammation, infection, and immune dysregulation, look at the role of chemokines and trafficking of immune cells by parasite infections. The hallmark of parasite infections, including dental. If I still keep picking up dental problem, but I treat the gut, I can never get rid of the parasite until I send to the dentist to remove those hidden dental infections. They are polycomplex. They have multiple microbes, multiple parasites that carry within the parasite its own parasite, bacteria, virus, and fungus. Classic example is the Lyme. The nematode have a Lyme Borrelia bodafri. Then eventually become chronic in nature, may drive an immune response toward exhaustion. So there's a chemokine response to parasite antigen by stimulating Th1, Th2, Th17, and Treg17. So initial phase, increase in acute allergic-like immune response, and late phase would be autoimmune-like response to the suppressing acute allergic response. So if you look at from Th1, especially I'm interested in Th2, it says Th2 regulates eosinophil, basophil, and mast cells. Cytokine rentius, or called CCL5, is chemotactic and activity factor for human eosinophil. Now you need eosinophil to get rid of the parasite. So Th2's first responders for parasite, and high rentius are expressed in epithelial breast carcinoma in cell line. So we see the connection, dental, rentius, maybe the reason is maybe a parasite, and raise the rentius to stimulate the eosinophil count, and going after the parasite. And they also go to the weak link that is in many breast cancer patients, we see in the breast. So that's kind of we're trying to see the connection between dental and the rest of the body. Those of you who have not read, it's kind of a hard book to get. Patrick Stoltbecker, he's a MD, PhD from Sweden. He's a neurologist, wrote a book. I think it's a very monumental book. I think every dentist should read, as much as all the medical doctors should read. Wrote a book called Dental Caries as a Cause of Nervous Disorders. And it's kind of boring topic as a subject, and nobody really read the book. I got his book for 1 cent, well, $1 actually, $1 for the book. And in the book, talking about when you infect your herpes simplex in the eye with a cornea, it takes about 7 days to retrograde into a stem cell. When you have a heavy metals, it takes about like 8-9 days to retrograde into the stem cell. And any dental infection will go also retrograde down to your brainstem and to the brain. Now I want you to understand that this cranial vein called emissary vein do not have a valve to protect from intracranial pressures. So they do not have a valve. If you have any infection, heavy metals or cavitations, they will retrograde. Especially when you're lying down, it will go through retrograde down. And look at from here. Here's the trigeminal nerve and the vagus nerve. There's an input coming from the gut, the parasite problem, and there's a dental problem with any dental infections, cavitation, root canals, and amalgams. They all meet right here by the called monosclerosis. If you have multiple lesions called multiple sclerosis, they're all connected with the dental and the gut. So Parkinson, MS, ALS, they're all connected with the dental. So I cannot treat my patient without my dentist taking care of a dental problem. Only problem is, many times, X-ray will not show. So we have to go beyond the dental X-ray, beyond the cone beam. And I have one patient with Parkinson's disease. He's a contractor. He shakes like this. When I check, he's got dental problem, environmental toxin, heavy metals. He's got actually massive amounts of petrochemical exposure to it. It took him about a year to clean him out, and I still pick up dental problem. Only one I'm picking up is a bite problem. So I keep telling him to see a dentist who specializes in bite. And eventually he went. He had to save money to see the dentist. And one day he came up, he showed me, and his arm was like this. Before it was shaking like this. Just after he got dental appliance, there's no more tremors. He was totally control his hand. Now the most interesting part is about 4 months later, I saw him back again, and I said, "How is your tremor?" He said, "I have no tremors." So I said, "Are you wearing your dental appliance?" He says, "No." I said, "What do you mean?" And he said, he learned how to manipulate his tongue to change the position of his jaw, and he doesn't even have to wear the dental appliance. I found that rather interesting. But anyway, so all those people we see here, and here's a 5-year-old kid with nephrotic syndrome. I saw him first time in 2012 with nephrotic syndrome, diagnosed in January, and I saw him 1 month later. Only history is he fell, hit his face and teeth on December 2011. So the medical doctor and the dentist, they said everything was fine. But symptoms including abdominal bloating, puffy, extremely weakness, and heavy protein in the urine. When I checked the meridian system, dental and kidney was out of balance. So here, dental, here's a dental, allergy, immunology point, and here's a kidney point. You pull the tooth, and all those problems went away. Just pulling the two tooths out, that was perfectly normal in X-ray. So just speculating this, what's going to happen to these young kids? They fall down, they hit by the ball, and that can be asymptomatic, but that can be a traumatic, but create an inflammation and create a potential infections. And who knows what happened to those kids? Maybe brain tumor, they have some unusual autoimmune problem. Connection is actually with the tooth. This doesn't work very well, you know. Oh, computer. Oh, I see. So after pull the two tooths out, it looks fine. I'm sorry, I'm pointing at the wrong place. So you probably know about homotoxicology, the excretion phase, reaction phase, deposition phase, and going into impregnation, degeneration phase, and neoplasm phase. You pick up parasite when you're crawling on the floor, when you're 1 year old, 2 years old, gradually pick up throughout your life, get the root canal done with a sports injury, and 10, 15 years later, this patient developed prostate cancer or breast cancer, and they don't see the connection between what happened 10 years ago, 15 years ago, and developing cancer. And but that's a kind of a repeating theme here. This is one of my favorite slides to show. It's actually from Dr. Boyd Haley's 25 years ago, his lecture in California for the American Academy of Environmental Medicine, talking about those mercury is so toxic, especially for the sodium potassium pump. Is one of the most sensitive to the mercury. You know, whatever we went through for last couple of days, this mercury shuts your ATP potassium, sodium potassium pump, and it completely shuts your system down. So one of the most common complaints is fatigue, anxiety, depression, and forgetfulness, Alzheimer's are all associated with mercury. Here's a tale of two Lyme patients. 65-year-old white female with the Agenix IgM and IgG test negative, clinically diagnosed Lyme with chronic fatigue, myalgia, neuropathy, brain fog, and now responding to IV antibiotics, ozone, IV laser therapy, especially IV laser therapy designed for Lyme. Her husband is positive for IgG, IgM Lyme test, positive for Agenix, and totally asymptomatic. So how could they make a difference? Is that one is totally asymptomatic with a positive Agenix, and one is actually Agenix negative and all the symptoms of the Lyme. What is the difference? His wife have 6 root canals. Remember in one of the slides, they have a treponema. Treponema is a spirochete family. They will mimic just like Lyme. So Lyme and chronic post-Lyme problems, we have a Borrelia burgdorferi, Treponema pallidoma as a syphilis, and all those Treponema, Denticola vincenti, Sacronsky, and Pectinonovum, they all are periodontal problem. They're all part of this spirochete infection. They mimic exactly like Lyme. Here's an 18-year-old white female diagnosed with Lyme. Severe fatigue, headache, nausea, joint pain, insomnia, dizziness, brain fog, on multiple antibiotics and antifungal medication with a C-reactive protein of 7. And if you look at it, we always see co-infections like a mycoplasma, CMV, Bartonella, and Epstein-Barr virus, but they are not the driving force. It's actually the dental infections. Now, this is for advanced technique. I train physicians and dentists. It's called enhanced interrogation technique. I put a few acupuncture needles on my patients, and all of a sudden you see problem that you couldn't see before. So it's like this. The patient looks already on antibiotics and antifungal medication, and they look perfectly normal. And I put a couple acupuncture needle, and almost instantaneously, patient have this problem showing up. That's dental problem, allergy, immunology point, heart and small intestine. That's a pattern we see on the wisdom tooth areas, and here's another heart meridian. And there's a 4 undescended wisdom tooth, and there is an infection down here. And when you tell them to pull the wisdom tooth, many times people don't come back. But that's the underlying problem. It's a dental infection mimicking just like a Lyme. And often Lyme have a core infections, and we have to think about the spirochete as a part of the major core infection and from the dental problems, and we treat them as if they're Lyme. So you treat them with antibiotics, patient gets better. You stop the antibiotics, and the symptoms come back. The missing link, dental. It's a dental problem. He's a 34-year-old chiropractor with the chronic fatigue. They're questioning about the Lyme. All those, look at those one tooth. It's a perfectly normal-looking tooth. One tooth, we did a DNA test, and somewhere along the line, here's an entamoeba, there is a treponema. There's a pattern is there. I've been doing this long enough. I use the triple antibiotics, but I want to make sure the tinidazole and doxycycline or azithromycin with the amoxicillin or augmentin as a part of the day they operate, they pull the tooth, I put them on usually minimum of 10 days to 21 days, up to 30 days. Those people who have a cancer or neurologic disorders. Otherwise, it takes me 3 weeks for them to get the report, and I want to treat them ahead of time. Here's a 10-year history of a Lyme patient, was on IV antibiotics for 10 years, still have a lingering problem with the fatigue, some myalgia, neuropathy, and when I check, it's a dental problem, sent to the dentist. They did a cone beam for cavitation. Among those 4, one of the major concern is, I think it was Dr. Miller talking about this, CT scan doesn't tell you whether it's actually active infection or not. 2 out of 4 is the main problem, not all 4 out of 4. So how can you tell the difference between for cavitation by the X-ray, then which one you're going to correct? This is an important question you have to ask. whether you do muscle tests, some kinesiologic tests. For me, I do meridian testing as a means getting to subtle energy field, touch individual tools, and there's a major drop in energetic pattern. That's why I go in. So among those 4, actually 2 out of 4 is an active problem. So looking at here, false positive or false negative cavitation, whether you use X-ray, cavitate, or 3D CT scan cone beam. And I'm asking, maybe acupuncture meridian assessment can be as a new functional diagnostic tool. I'm just throwing at you guys because I train physicians and dentists look into that part of it. Now, parasite, I'm not going to get into those. Billions of people are infected with a parasite, and this is based on standard tests. What they don't tell you is that many parasite problem is diagnosed as asthma. We put on many asthma patients, you put on parasite medication, asthma goes away. Many migraine headache, MS patients, put on parasite medication, the problem goes away. So there's a misconnection between the parasite problem using standard tests and for me looking at from meridian evaluation. So people ask, how do I get into this parasite medication? Until 2001, I did not use parasite medication. I've been doing this EAB meridian testing, and when patients have a irritable bowel syndrome or colitis, you put on natural parasite medication, and the patient come back 1 month later, their IBS went away. Patient is happy, I'm happy. But after I came back from Bolivia, year 2001, when the patient come back, I use the same medication we use. That's a parental palmoid or mebendazole. That's what we use. And the patient come back and their IBS went away. But people will always ask, oh, by the way, do you know whether this medication has anything to do with it? But my asthma went away. My migraine headache went away. My hip pain went away. My knee pain went away. My neurologist said, I don't have MS anymore. My oncologist, my cancer is under control now. They couldn't control it before. All those, so many what we call by the way. So I wrote a first book, is called Accidental Cure, because I couldn't really claim that parasite has anything to do with it, but I've seen so many clinical observations. So why parasite problems are overlooked? I'm not going to go through all those. People think parasite is from intestinal tract, but a lot of these parasites are actually outside of the intestinal tract. And they'll go everywhere. And they're very difficult to detect. The current technology to detect parasites are just not reliable. They're very deceptive, adaptive, difficult to eradicate. So standard tests will only cover for obvious problem. But once you start using the meridian testing, I was actually uncovering there are so many hidden parasite problems manifest as asthma, migraine headache, as a Lyme, or all those other underlying problems. There are multiple signs of a parasite. Parasites speak many languages as a signs and symptoms. The list goes on and on and on. Paroxysm is one of them. It can cause an allergy problem. It can suppress the allergy problem. It can create what we call immune deficiency syndrome. It can cause a cyst. The list goes on, including many psychiatric problems. And parasites have its own concurrent co-infections. They bring with them virus, bacteria, archaea, intracellular parasite, ectoparasite, cell wall deficient bacteria, mycoplasma. The list goes on. And also, for me as a physician, I'm looking at it, social, political, economical, what I call a parasitic relationship. By the time people are chronically sick, cancer or neurologic problem, often they have to break away from that parasitic relationship. So parasite medication and dental care for anti-aging, deworming horse, and also for human. One day I was seeing a patient from Iowa, and she's a horse breeder, and I wrote up for ivermectin and parental palmoid with the tinidazole, and she's looking at it. She said, wait a minute, this is what I give for my horse. So we had a nice, interesting conversation, and she said, in old days, this horse used to live for 20 years, about 25 years old. That's their typical lifespan. But with a modern horse, with the breeding technique, and improvement in dental care and the nutritional state. They say the old, nowadays they deworm the horse at least twice a year. The racing horse, they deworm 4 times a year. And the horse can now live 40 to 45 years without having any problems. So this is what I call anti-aging by dentistry, proper dental care, and by the regular deworming. So just give an idea how much you play important role, but medical field don't really appreciate what you really know, what you can do, you know? So if you look at from evolution point of view, we have a universal ancestors, RNA, DNA, and then we have a archaea, bacteria, protozoa, we have a plant, animal, fungi, and we have a Homo sapien and the parasite. The point I'm making is that maybe the parasite is a part of the end of the evolutionary products. They are the top of the food chain, and they control our human mind, behavior, in the way we do things. And the fungi is our chief undertaker. So that's kind of from evolution point of view. And we do have also protozoa, and there's a bacteria. The dental usually go in this particular area here. Protozoal parasite, bacterial, some actinomyces, fungi-like bacteria here. But we have to have a better control for the parasite from, as a medical doctors, I look for all those nematode and schistosome and tapeworm, but also there's a parasite from the protozoa is in your dental infection. So there's a multiple factors contributing to Lyme, post-Lyme, and cancer patients. I talked about parasite mainly, and the bacteria as a dental infections. But we also have all those environmental toxins. I briefly mentioned about all those mycotoxins, environmental toxins, and heavy metals, nutritional imbalance and deficiency. And we have some genetic problems, the cell signaling problems, the chemokine. And we have many unknown, that is known as social interaction, dental, electromagnetic field, and toxic emotion. They all play the role. So my lecture is based on the dental and parasite, but I address all of those issues as a part of the whole, looking at the evolution. And what we are seeing is metabolic dysfunction, mitochondrial damage, and I see the pick up the signal through the extracellular matrix, through the Acupuncture Meridian Assessment. So what we are seeing is a Lyme, post-Lyme, chronic disease, and cancer through the Acupuncture Meridian system by checking the extracellular matrix. So think dental when the latest medical therapy fail. Dentistry need partnership with the dental medical doctors who understand energy medicine and trying to connect the dot. This is what we really need, a partnership, the dentists and medical doctors working together. Yeah, one of the few early groups trying to bring together dental and medical together. I'm trying to pointing out, to tie together, we need energetic system, not just a biochemistry, but energetic system to tie together. So I train physicians and the dentists on these subjects, and I think that was it. I do have a book out there. I brought some books. I got my first book is called Accidental Cure, and my second book is called Accidental Blow-Up in Medicine. So that's the end of my talk. I just hope I tie together the why dental and medical is so important, and to tie together, we have to get into the subtle energy medicine. And thank you for the invitation.